My name is Zoë Clark. I'm Self-Management Programme Officer here at NASS, and today I'm going to be talking all about what to do to help manage your axial SpA in times when you're less active. So I'm going to focus a little bit on when you have surgery, and then a little bit on if you have an injury or an illness, so what you can do to help prepare for those events, and then how you can help manage your axial SpA if you are less active because of these reasons. Hi Pam, I see Pam just said hi in the comments. Thanks for joining today. So as I said, please do share your experiences and your advice. And as always, I'll answer your questions as we go through or partway through and definitely at the end. So I think we'll get started then. Please do say hi as you join the session. If you do join partway through, that's absolutely fine because the video will stay on the page afterwards so you can catch up, and we'll also upload it onto our web page, My AS, My Life, which I've linked to in the video description. So the first topic today that I'm going to start with is looking at if you have surgery scheduled for any reason, not just for your axial SpA. It's something that it's a little bit easier to prepare for compared to something like an injury or an illness, obviously because you don't know that they're coming up. So really the first thing I would say is if you have surgery scheduled, then as soon as you can, far in advance of the surgery, speak to the rheumatology team that you usually see, and also your surgical team as well. There are different things that you'd want to discuss with both of them, so I'll go through those separately. So for your rheumatology team, it can be really helpful to speak to them way in advance and ask them about any medication that you're currently taking, whether that needs to be modified for the surgery, and also if there's any other medications that might be helpful for you in the build up to the surgery and afterwards. This is particularly important if you take immunosuppressing medications such as the biologics, because sometimes your surgeon will ask you to take a break from that before the surgery and afterwards as well, to help reduce the risk of infection and help to speed up your healing time as well. So if you know that this is coming up, your rheumatologist can give you advice on when to stop it, and your surgeon will tell you when to restart it. But what people sometimes find is if they've had a gap in their usual medication, they then find other medications might be helpful to help you manage your inflammation and manage your pain in the meantime. So for example, you might take an anti-inflammatory more often than you would usually to help you cope with that gap in your normal treatment. And it can also be really helpful to ask the rheumatology team what you need to speak to your surgeon about, and what about your axial SpA that you need to make the surgery team aware of as well. When you do speak to your surgery team, they'll be able to tell you an estimated time of recovery for your surgery. So this can be really helpful then if you're speaking to your physiotherapist about what you can do activity-wise while you are recovering. The surgeon will give you advice on when you can restart the immunosuppressants if you are taking those. And they'll also be able to advise you on any movements or any activities that you need to avoid after the surgery, and things that you can do as well. So as I said, speaking to your physiotherapist and your surgical team in combination can be really helpful. So for example, if you usually do a lot of walking to help manage your axial SpA, particularly for hip and low back pain, they may well advise that you can do swimming or cycling instead to help you keep that movement going while you're recovering. Obviously, this is going to depend on what you normally do for activity and the surgery you're having, but they can give you that real individualized advice. And then you'll always have an appointment with your anaesthetist before a surgery if you're having an anaesthetic. So when you do speak to your anaesthetist, make sure that you inform them of your axial SpA or your AS, and inform them of how it actually affects you individually, because obviously it affects us all differently. Especially if you have any spinal fusions, it's really important to discuss these. If you're having a general anaesthetic, then it's really important that you make them aware of any problems with your neck or your jaw, particularly if you have any fusions or restrictions to your movement. Generally, the anaesthetist will check your neck movement and your jaw movement if you will be having a general anaesthetic, but just make sure you really reiterate this to them if that's the case for you. And it is quite common that some people with axial SpA can't lie flat on their back. So if you know that this is difficult for you, or if there are any other positions that are difficult for you to do or impossible, do make your surgical team aware of this way in advance. Generally, they can work around any sort of modifications they need to. If you let them know in advance, then they're able to make those changes, have the right team and have the right equipment for you. Obviously, if you just let them know on the day, it may well be that they don't have the right team or equipment to be able to change this, and that might then delay your surgery. So the earlier you can share this with them, the better. And some operations use a spinal block or an epidural. So that's where you have a local injection into the spine rather than a full general anaesthetic. This is also really important to let them know well in advance about your axial SpA, because some surgeons will want to do an MRI of your spine beforehand, just to make sure that the area that they would be injecting is going to respond well to the injection and the anaesthetic. They may well decide to use a general anaesthetic instead, but all of this can be decided well in advance. And as I said, generally they can work around anything. So even if you have severe neck fusions, they generally have team members and equipment that they can use. Even if you need a general anaesthetic and you don't have the usual movement in your neck, they'll be able to discuss the options with you. I'll just say hi to George, who's joined the session as well. Thanks for commenting. I'll keep an eye on the comments as they come through as well. And please, if you have any experience in this area, if you've had an operation or anything like that, share what you've done in the past to help you prepare and what's helped you. It's always good to get everyone's advice, because obviously we all experience things differently. So just finishing up on the topic of surgery, it's really important, as I said, to let everyone in the team know about your axial SpA. And even on the day, often there'll be lots of different healthcare professionals that you'll see on the day of your surgery. So making sure that each professional you speak to, you're telling them about your axial SpA, anything they need to be aware of or cautious of, any restrictions you have. It can also be helpful to have these written down. So preparing some A4 or A5 sheets with just 2 or 3 brief bullet points, just stating the condition that you have and how it affects you and anything they need to be cautious or aware of. That way you can then hand those out to people before your surgery, but also to the ward staff after your surgery as well, so that everyone knows. And on those changeovers of shifts, if you're staying in overnight or for a period of time, you know that everyone that you see is going to be aware of what can help. I was chatting to my colleague Sally before the session, and she mentioned, even something where you have reduced movement in your neck, if the member of staff knows that, then they're not going to mistakenly put, say, a glass of water on a table next to you where it's actually out of your peripheral vision. They're going to know to have the table in front of you where you're then able to see it and reach for things. So it seems like a really small thing to mention, but actually it can have a really big impact on your recovery and your experience as well. And in terms of recovery, if you do find that you stiffen up really quickly with your axial SpA, then do make the surgical team and the ward staff aware of this, so that they will be really keen to get you up and get you moving as soon as it's appropriate. You can also speak to your physiotherapist before your operation as well to ask them about any exercises or movements you can do if you are having to sit or lie down for long periods of time afterwards. They can then give you some advice on things that will help limit the stiffness you experience and reduce the risk that you'll get a flare-up afterwards. And then when you're back home, make sure that if you're taking medications regularly, particularly pain medications, just keep a notepad nearby, so that each time you take something, you note down the time and the dose, so that you really keep track, because it's really easy to either go too long between doses or have them too close together if you're not keeping track, particularly if you're feeling drowsy or tired on the recovery as well. So again, I'll head to the comments and just see if anyone has shared anything so far. So I can see we've got quite a few people joining us now. Thank you. If you have joined us partway through, then you can catch up on the beginning later on. The video will stay on this page, and we'll also upload it onto our website as well. So hi Heather, hi Naomi for joining. And Naomi recommends bed yoga. That's a really good recommendation. She said not just for after operations, but on flare days as well. That's a great recommendation. Thank you. Wonderful. So the next topic, as I said at the beginning, we'll be talking about injury and illnesses. So this is more about if you find that you're suddenly less active, how you're managing your axial SpA. As I said, you do have the benefit when you have a surgery scheduled that you know it's coming up, you can do lots to prepare for it. So this is all about what you do when suddenly you're less mobile and less able to look after your axial SpA in your usual way. So again, speaking to your healthcare team, whether that's your rheumatology team or your GP, is really important, because they again can advise on medications that you can take, on exercises you may be able to add into your usual routine, but also they can talk to you about any equipment or home adaptations that would be helpful for you. So some GPs can refer you to occupational therapy, or they can refer you to local services where people come into your home and discuss your condition or your injury and what around the home would be helpful for you. So for example, they can even, in some areas, they can actually put in those adaptations for you, for example, handrails to help if you're having difficulty with balance, with walking. They can do things where they raise your seats up and raise your toilet seat up if you've got problems sitting down on something quite low. And these seemingly small adaptations can really make a big difference in your recovery. And some of these areas also loan equipment as well, so do speak to them, and also just have a Google of local charities, because sometimes charities such as the Red Cross will loan equipment if you're just going to need them for a short period of time, and that can save you buying lots of equipment that you may not need long term. And then onto the topic of actually managing your joint pain and your joint stiffness. I mean, it's going to be the same kind of information that I'd give you for a flare-up, but sometimes it means that you're thinking outside the box a little bit. So it may be that you can't walk long distances for a time. So just making sure that you have a timer on your phone or on a clock, so that every hour you get up and walk around for 5 minutes. Even if, like I was doing recently after a recent operation that inspired the session, you find that just getting up and doing laps of your living room for 5 minutes every hour, it can make a really big difference. Just helps loosen up your joints, particularly in the back and in the hips and the pelvis. You'll find if you're sitting for longer periods of time than usual, it can really build up to cause axial SpA pain at times. So that small amount of movement often can be really helpful for getting that movement in, but also managing your energy levels at the same time. Also, if you are less able to be up on your feet when you're recovering, doing seated exercises or lying exercises, as Naomi said, bed yoga can be really helpful. And I have put a link in the video description to the section of our website where we have videos of daily exercises. These show some exercises in bed, some sitting, some standing. So it may well be that usually you wouldn't do these types of exercises, but at the moment, you know, in that recovery stage, they can be really helpful at managing things. And in terms of sitting more, make sure that you invest in a really good pressure cushion. So you can just go on Google or on Amazon. There are lots of different brands out there, but cushions that help just relieve the pressure on your sitting bones, your hips and your lower back can make a really big difference, because often these are the areas that tend to become stiff and painful first with axial SpA. And if these are usually a problem area for you and you're sitting more, it can be really helpful to prevent things flaring up. You can also use neck pillows as well if you're sitting for long periods, particularly if you find that you're nodding off when you are sat down, if you're drowsy from either from tiredness or from the pain medication. So using a neck cushion is really helpful, because then if you do fall asleep, you've got that support there. You're not going to suddenly wake up with a crick in your neck. And I'll just check the comments as well as we go through, see if we've got any more recommendations from everyone watching. I can see. We've got a long comment from Alexia, who's been recovering from emergency surgery in her abdomen. Waiting for a bed in minor injuries was a nightmare because there are only seats. So yeah, absolutely, that can be really uncomfortable, often because of hygiene as well. They're just plastic seats as well, so they have no cushioning whatsoever. So Alexia said they found Pilates stretches and walking around were really helpful for reducing that seizing up. I'm really glad they helped you, and thank you so much for sharing that as well. And actually, we've got a Pilates session next week, which is focusing on Pilates exercises for a morning routine for reducing stiffness. So actually, it ties into the session really well. So do either tune in for that or come back and watch it on catch up as well. And in terms of sleeping, it can be really helpful to use lots of cushions around you when you're recovering from something. You may find that you need to be propped up if you can't lie flat on your back. So the more cushions, the better. And sometimes it's a matter of really just thinking outside the box. Rolling up towels to use around your neck if you don't have a neck cushion can be very helpful. And just remembering that the position that you start in as you fall asleep, obviously once you're asleep, you may well relax and then move position. So if you can really make sure that you're using lots of things to help prop you up and support you, then you're less likely to wake up with pain. If you find that you're having to sleep in a chair, again, using a pressure relieving cushion to sit on is really helpful. And also raising your feet on a footstool can be very good for circulation, but also then taking the pressure off the hips and off your knees as well. And if you're finding that you're getting a lot of pain and stiffness at night, it may well be that because you're still for those long periods, there's that inflammation building up and causing that joint stiffness. So do speak to your pharmacist or your rheumatology team or your GP about the different medications you can take to help control that inflammation. There are also pain medications that you can take which have a slower release, which may be more appropriate. And they may even advise you to change the timings of your usual medication. For example, some people find that taking their anti-inflammatory later in the day is actually really helpful, because then that helps you overnight when you're less active. And then during the day when you're able to be up and moving, it helps when the dose is a little bit lower in your system. But do speak to them for that more individual advice. And again, in the video description, I popped a link in there. That's to the night pain blog. We did a whole session all about night pain. That's got much more detailed information about that. So do have a look there if you are struggling at night at the moment. And of course, don't forget all the usual things that help your axial SpA as well. It can be really easy when you're in a flare-up or when you've got something else going on, that, you know, another medical condition or an injury, or you're feeling unwell. It's really easy to forget what normally helps you. So the seemingly simple things like using heat, using massage for a painful area, TENS machines, and having things like distraction techniques, things that take your mind off the pain and stiffness as well. These are all really important, but so easy to forget. One of the best ways to make sure these are at the front of your mind is to make sure that you store all of these things in one area. So you could have a particular drawer or cupboard, you could pop them all in a box together. It just means that if you're in pain, or if you're fatigued, or your joints are feeling bad, you know exactly where you can go to have a whole range of things that may help. Because often something may help for one type of flare-up, but it may then not help for another. So if you've got a whole range of things all in one place, you're going to find something that's going to help you. And it's really important in here to keep the contact details for your healthcare team as well, so that if you find you've gone through everything in your flare toolkit and nothing's helping, you know who to call and how to get in contact with them if you are struggling and you need that individualized advice too. So again, I'm just going to have a look in the comments and see what you've all shared. So we've got some really good advice coming through already, so that's really nice to see. So Pam's asked, any advice for when your axial SpA physio is put on hold as you're waiting for investigations under a different specialty? So I would say, I mean, all the usual advice in terms of, I think you commented this before I went through the usual flare technique. So all the usual advice in terms of managing your flare. I would hope that you'd still be able to access the physio despite looking for investigations for something else. If you're finding that's not the case, do feel free to drop me an email, zoe@nass.co.uk, or give our helpline a call as well, because we might be able to give you some advice on that. But also just looking at the exercise videos we've got on our YouTube page, there may well be some exercises that you can incorporate yourself, which will just help keep things well managed while you are waiting for that appointment. But do let me know if you need any more advice from that as well. And I've seen Sally has got a very good comment in there as well. She's advising you, you know, to be really open and clear about your needs, and sort of, you know, it's really easy sometimes to kind of be stoical, not want to sort of be a bother or be a burden. So it's yeah, it's really helpful just to sort of be really clear about what you need as well. So before I finish up in terms of my advice, I did also want to touch on emotional well-being as well. I think it's something we can really easily overlook, but of course, you know, mental health is just as important as physical health as well, and they're very interlinked too. So if you're dealing with an injury, an illness, or surgery on top of your axial SpA, that can sometimes be quite difficult. It can be really isolating. And so it's really important to recognise that doing things to help with your emotional well-being can be really beneficial and really important as well. So if you have friends or family that you can speak to, it can be really helpful to talk to them. If you have a local NASS branch, it can be really helpful to join the branch and join in with their sessions, because everyone there has a whole variety of experience. So they'll be able to empathise with you, and they may be able to give you some advice as well, or just provide that listening ear too. And there are lots of groups and patient advocates on social media as well. So sometimes you'll find you can connect with other people who are going through a similar thing, and that just gives you that emotional support. And as well, in the comments, I've linked to our whole section on the website on emotional wellbeing, because we've had sessions from Anxiety UK, we've had relaxation sessions. I've done a few videos on self-care techniques, distraction techniques, and so on. just make sure that you are taking that time for yourself and you're really aware of looking after your emotional well-being as much as you can, and finding that support when you need to as well. On our emotional well-being page, we've got lots of information about other charities and organisations you can contact, such as the Samaritans, if you need someone that you can confidentially talk to if you're struggling at all. And it would be really helpful as well in the comments if you're watching, is just share what works for you as well in terms of your emotional well-being, because some people like to talk to people, some people would rather sort of deal with it on their own. So it can be really helpful to hear all the different coping techniques that we've all gathered over the months and years. So that's the main information that I was going to share today. Again, I'll go back to the comments, and I'm happy to answer any questions that you may have. And also it'd be great, as I said, to see what you recommend for each other as well. I've seen as well, in terms of Alexa's comment earlier, mentioning the Pilates was really helpful, but also recommending using extra pillows and blankets to prevent joints getting too cold or stiff. That was particularly when waiting in hospital. That's a really good tip. Just make sure that you keep warm and keep comfortable as well. Can't see any more comments coming in at the moment, but that could well be my technology. So hopefully that's been really helpful for everyone. As I said, we've got lots of links in the video description, so do go back and have a look there as well. And there's also a blog being published on As One today, all about this topic. So if you want an action plan, that can be really helpful. You can just go and copy and paste that or print that out when you're preparing for something. So I'll just check the comments a couple more times. My internet is being a little bit slow today, which is always helpful. So Stephen's asked for advice as his wife's just been diagnosed and her appointments for physio are being cancelled. I mean, as I mentioned earlier, do feel free to get in contact with us if you need any particular advice in terms of accessing care. Sally in particular can be really helpful with that as well. I would say definitely have a look on our YouTube page at the exercise videos that we've got, so that while you are waiting for those appointments, you can try out different exercises. We have things varying right from very gentle seated exercises all the way up to Pilates or HIIT exercise. So however her symptoms are feeling at the time, hopefully there's going to be something there that would be helpful. But I would say definitely get in contact on our helpline. We can have a chat about that. I'll put the I'll reply with the helpline number shortly. But yeah, definitely sort of find some exercises that are going to help in the meantime. And I'm just saying, hi Jane, thank you for joining us. Lovely to see you. I think I'm up to date with comments and questions there, but I will monitor the questions in the comments over the next few days as well. So if you do watch this on catch up, feel free to add something there and I'll answer. If not, a little bit later on, just drop me an email, zoe@nass.co.uk. Ian, hi, thanks for joining. Absolutely, Ian says try finding a good Pilates or somatics instructor for one-to-one advice for exercise while you wait for physio. That's really good advice. And you can also find Ian's somatics videos on our website and on our YouTube page as well, and I really recommend those. It's really good taster to the session, but we've also got his contact details in there if you wanted to get in contact with him about some one-to-one advice as well. As I said, next week we've got a Pilates session as well, so hopefully we've got something for everyone. Wonderful, so I'm all caught up with the questions and comments, but thank you so much to everyone who's joined the session. Thank you so much for sharing your experiences and your advice, and as I said, I'll keep monitoring the comments over the next few days as well. So next week we've got Pilates and Ruth Larkin, who's a sports therapist and Pilates teacher, is joining us to give a morning routine. So that's particularly helpful when you are stiff and painful, to get your joints moving and start your day in a slightly better way. So that is on Wednesday, 29th of September, and that's at 12 o'clock. And as always, we'll share it on our webpage, My AS My Life, afterwards, and it'll also stay on our Facebook page as well, so you can catch up afterwards. So thanks again, everyone, for joining and for sharing what works for you, and look forward to seeing you all next week when I'll be joined by Ruth. Take care, everyone.